I'd like to talk about another common cause of stalled weight loss. This is discussed further in my Undoctored book, Undoctored: Why Healthcare Has Failed You and How You Can Become Smarter Than Your Doctor. So there's a long list of factors that can block weight loss, cause weight loss plateaus in the book. But one of the issues are prescription drugs. Many people take prescription drugs that prevent any weight loss, or at least slow it down. Many of these drugs block weight loss completely and have, over the years you've taken them, caused weight gain. Maybe you've been gaining weight, didn't know why, didn't know that the drug the doctor prescribed was causing you to gain weight. Now, you'll be shocked how few doctors actually know this. Now, I don't make this stuff up. If you get the package insert that the pharmacist has, you'll typically see weight gain as a very common side effect of these drugs. They'll also uncover studies. If you go and do an online search, you'll see that these drugs cause weight gain. But the doctor often doesn't even know that, because the doctors typically don't read the package inserts, don't read the studies. They do talk to the product representative, who is not inclined to tell the doctor these kinds of undesirable effects. Imagine this nice, good-looking sales rep tells the doctor, well, about 18 to 50% of people gain 8 to 10 pounds in the first 6 months taking this drug. What do you think he's going to think, right? So that is often not disclosed to the doctor, and he or she won't know that. So don't be surprised you get resistance from the doctor. But a common class of drugs that causes weight gain or blocks weight loss, beta blockers, such as metoprolol, nadolol, carvedilol, propranolol. These are prescribed for a variety of purposes: for hypertension, for migraine headache prevention, for anxiety, to reduce heart rate. So whether you can stop them depends on why they were prescribed in the first place. But be aware that beta blockers, the very common class of beta blockers, all block weight loss. So you want to talk to your doctor about getting off, if possible. Most people can, and have it replaced by a more benign agent that doesn't cause weight gain or stalled weight loss. Or you can get off entirely often by following the Undoctored, Wild, Naked, Unwashed program that addresses such issues as hypertension and reduces blood pressure. Another common class of drugs are antihistamines, both prescription and over-the-counter. All antihistamines block weight loss and cause gradual weight gain the longer you take them. So once again, the Undoctored, Wild, Naked, Unwashed program reverses allergies in many people, and perhaps that'll be part of the formula for you to get off of, become less reliant on antihistamines, or at least have them necessary only on occasion. Inhaled corticosteroids, that is nasal inhaled corticosteroids, are a pretty benign alternative to antihistamines if you need to use them, that don't cause weight gain. Antidepressants is a whole big world of drugs that block weight loss, including drugs such as Elavil, Pamelor, Sinequan, Paxil, and others. If you have a suspicion that you have been gaining weight on your antidepressant, talk to the doctor who prescribed it. Talk about your concerns. Ask to change to an agent that doesn't cause weight gain, or perhaps you're on the Undoctored, Wild, Naked, Unwashed program, and that is making you feel better, which is very common. This program typically gets people off antidepressants, but it should be done in conjunction with someone who's objectively watching your mood. Anti-inflammatory drugs, such as naproxen, ibuprofen, Vioxx, these all cause weight gain. Sometimes a lot of it's due to fluid. So be aware of that also. And once again, the Undoctored, Wild, Naked, Unwashed program typically reduces, sometimes eliminates many forms of pain, like joint pains, and many people can come off these drugs safely and won't need them. Lyrica for fibromyalgia and other sorts of chronic pain is a flagrant cause of weight gain, often large quantities of weight gain, 30, 40, 50 pounds. Beware of that. And once again, the Undoctored program can get you started on a program to reduce chronic pain, including that from fibromyalgia. Drugs for diabetes, big world of weight gain effects, especially Actos and Avandia, typically given for prediabetes, sometimes to diabetics, can cause flagrant weight gain. Insulin is an incredibly effective weight gain drug. So I've seen many people started on insulin and then gain 25, 30, 50, 60 pounds in the first year alone. Recall that insulin in our bodies is the hormone of weight gain, fat storage, and suppresses fat mobilization. If I inject Insulin, the same thing occurs, but worse. It causes weight gain. It blocks any hope of mobilizing fat to lose weight. So now, and once again, the Undoctored, Wild Naked Unwashed program requires that you reduce insulin almost immediately because we avoid hypoglycemia. And it's the first step in the process to get you off insulin if you're a type 2 diabetic, or on the least dose of insulin if you're a type 1 diabetic, or the in-between form, the LADA, latent autoimmune diabetes of adulthood form of diabetes, in which case you'll still need some insulin, but the dose will be minimized, and thereby the weight gain effect minimized. So recognize that insulin is an enormously effective weight gain drug, and so getting down to the minimum you need or getting off is a very desirable goal. Now that's just a partial list. Those are the most common, most offensive drugs, but there are others. So if you are on several drugs, there's a high likelihood that you're taking one, if not several, drugs that block weight loss or cause weight gain. So you want to have a very serious conversation with your healthcare provider. If you don't get their attention or you get blown off, walk out. Find a healthcare provider, perhaps a functional medicine practitioner or an integrative health practitioner, who is in tune with these issues and will work hard to get you off these drugs, perhaps find alternatives that don't cause weight gain, or even get you off these drugs entirely, especially now that you're on the Undoctored program that helps you minimize, absolutely minimize your reliance on such drugs.